Okay, good afternoon, everyone. My name's Nicole. I am a prospective student advisor here at Flinders University, and with me today I have Dr. Michael Jackson, who will be doing most of the talking today. Thank you all very much for joining us today. We really do appreciate you taking the time to come along and listen in to our Bachelor of Clinical Sciences, Doctor of Medicine webinar tonight. Just a few things to note though. If you have your microphone turned on, could you please turn it off? There is no need for you to have your microphone on, and it just means that other people can't hear as well. There's also no need to have your video on, but if you'd like to, you're more than welcome to. And of course, you may have seen that there is a chat function available. If you would like to ask a question, we do invite you to type your questions into that chat box. However, we do ask you that you type them to everyone so that if your question does get asked, we can answer it via the chat function, and perhaps other people will see your question and they might have the same one. So please don't send private messages to us. Please chat to us in the everyone section. You can type those chat function, so you can utilize that chat function throughout this entire webinar, and we invite you to do so. And we will perhaps get Michael to answer some of those questions for you more specifically at the end of the webinar as well. So for now, I think what I'll do is I'll hand you straight over to Michael, but just a reminder again to please turn off your microphone if you haven't already. Thanks, Michael.
Oh, fantastic. Thank you very much, Nicole. So I apologise in advance for my voice. I've got a bit of a cold, or just finishing one at least, so a little bit croaky. But thank you for tuning in today, and I'd like to, so thanks for tuning in. And so today I'll be talking to you really about the two pathways that we have for medicine, the graduate entry and the undergraduate pathways. And at the end, as Nicole said, there's opportunity for questions to come through, so hopefully you'll be able to answer any questions that you have at the end of this presentation. So who am I? I'm an academic at the College of Medicine and Public Health. I've got a background in medicine and research, and so at the moment I combine both an academic role and research role at the university. And part of my job is to look after the Bachelor of Clinical Sciences, Doctor of Medicine pathway, the double degree in medicine. Without further ado, let's get going. So obviously Flinders does have a graduate basis to its medical program, but we've also got the undergraduate or sort of streamlined fast track double degree into the program as well. So we offer both a graduate and undergraduate program. And as we go through, I'll talk to you a little bit about strategy for those students who really are determined to get into medicine and are applying for an undergraduate pathway but don't get that pathway for next year. Because obviously undergraduate medicine, just like graduate medicine, is very, very competitive. So many students will have to have an alternate strategy for getting into medicine. And of course, Flinders has the only graduate medical entry program in the state. So if you're heading for medicine as a graduate, you need to optimise your opportunities, I think, for the Flinders program. Excuse me. So as says at the bottom of the slide, this is a full-time course generally. Of course, there's only a very, very few exceptions where students would not study full-time, and there's no deferrals, so please apply in the year prior to which you're ready to commence. Okay, so this slide here shows, of course, the two pathways. So it starts with year 12 as a start point. For those students in year 12 with solid results and obviously looking for entering into an undergraduate medical program, for Flinders that would be the double degree Bachelor of Clinical Sciences, Doctor of Medicine here on the stream here. Obviously coming in with your year 12 completed and with also the UCAT test as well, which goes the undergraduate assessment test in addition to your ATAR score. So those of you heading into this program or planning to apply or applying for this year, next year's entry will have done your UCAT test by now. Excuse me. Now this pathway, of course, is a streamlined double degree, which means that you do 2 years of a preclinical science-based degree, the Bachelor of Clinical Sciences, and we'll look at what that looks like as we go through the presentation. And then you enter into the 4-year graduate program via this stream. If you do get selected into this double degree, there's no more selection between the 2-year undergraduate component and the MD itself, other than the requirement that you pass all of your topics and achieve a grade point average of 5 out of 7, which is equivalent to a credit average. So there's no more selection. There is a place reserved for you in the MD if you get into this double degree program. So that's for school leavers. If you do or have left school already and are completing a degree, or in fact don't get into an undergraduate program, you'll be looking at the graduate entry process, which of course requires you to complete a degree. We actually take students with any undergraduate degree at Flinders. We don't need you to have a biomedical degree for this. But in reality, the vast majority, probably 85 to 90% of students come in with some sort of science background, biomedical, paramedics, that sort of background, heading into this Doctor of Medicine 4-year program. So for entry here, of course, you have your 3-year degree and a GAMSAT result and sit in interview. So to say there's no interview for the undergraduate entry double degree at Flinders. Okay, so just starting off really talking a bit more about the double degree Bachelor of Clinical Sciences Doctor of Medicine, so coming straight from year 12. As I said, this is really a preclinical 2-year preparation for the MD. So we've put together a series of topics which we believe are excellent preparation for the Doctor of Medicine. So at the moment we have 2 different streams, and obviously this is a personal choice which stream you do. The topics in the middle here in black are common topics or core topics which are shared by both of the streams. However, if you do have a little bit of an interest perhaps in the research or medical science side of medicine, if you do the medical science stream, you get exposed to topics such as skills for medical scientists 1 and 2, and also some other topics such as academic professional communication. This will give you a little bit more understanding perhaps of medical research techniques, statistics, that sort of thing, or approaches to medically orientated research questions. If you are a little bit more interested perhaps in public health or that side of medicine, in other words, the interface between medicine and the public and society, then students will do the health sciences stream, picking up topics such as health practitioner 1 and 2, for example, and things like social determinants of health, which is really talking about which strata of society are better or worse sort of served by the health system itself. You'll notice also in the 2nd year there are electives in both streams, which gives you an opportunity really to tailor your studies to your personal preferences. From my experience, most students do tend to elect into the medical topics because they know that they're heading into the Doctor of Medicine and therefore they want to give themselves preparation in things like immunology, which is my field, neurology, those sort of areas, or pharmacology. So those sort of topics tend to be very popular. But we also encourage students, if they have an interest in things like history, if they want to study such a topic like that, or a language or something, that's a perfect opportunity to do that. Because what we want is this 2-year preparation. Yes, it's preparation for the MD, but also gives students a chance to be a normal undergraduate student, get used to university life, get used to study at a university level, have a bit of sort of a go at some of the interests that they have personally by taking electives perhaps outside of medicine if they want to, and really get themselves set up for that, the 4-year Doctor of Medicine, which I must say, of course, is a much more intense 4 years compared to the undergraduate 4 years, which is typical for most graduate-style programs such as the MD. Okay, looking at the MD itself, so once you do get into that, or if you're coming in as a graduate, for example, you may have studied a biomedical science degree or even a law degree or teaching degree coming in, doesn't really matter. As I said, we take people with any degrees as long as it's a full bachelor's degree. Coming into the MD program, you'll see it's made up, of course, of the 4 years, really moving from a more sort of lecture and university tutorial and skills-based process in the first 2 years into more clinically orientated sort of settings in the last 2 years. I will say though that basically from the first week or so, students will be exposed to the clinical setting. So within a week or so, you'll be out onto the wards and interacting with patients, which sounds a bit scary, but in this doctor and patient module here, we develop clinical skills in students, giving them the preparation and confidence really to do that sort of interaction with patients. And you're never expected to do things as you progress through the course that you're unable to achieve. So You will be trained very, very well. You'll have your competencies assessed and develop your skills and confidence as you go through, slowly getting more and more patient contact until you end into the 3rd and 4th years with your clinical rotations. You spend a lot of time on this topic here, knowledge of health and illness. This is all of the biomedical knowledge, pathology side of things, anatomy, histology, all of those basic biomedical sciences plus pathology associated with human disease. And it's really taught in modules, so you will tackle things like the respiratory tract, the immune system, homeostasis of the body in blocks, effectively, not sort of divided up into different subjects. Really, it's to do with body systems as a whole as you go through, learning really what makes someone's body work, what are the components, what happens when things are going right, what should that look like, and then what happens, of course, when things go wrong. Also, approaches to treatment in those disease settings as well as you go through. Health Professions in Society is all about the legal, ethical, and social aspects of medicine. So in other words, the interface between the medical practitioner, the health system itself, and society. Obviously, the medical system, the health system is there to serve society. Some members of society, of course, are served very well, and others are not served anywhere near as well. Things like rural locations would impact on the availability of health services, for example, and all of these sort of aspects will be tackled in health professions and society. Down here you can also see advanced studies. That is a research component, so just keep in mind that the MD is an advanced master's degree, so all students are expected to undertake some independent scholarship while they do their 4-year degree studies. This says, university-based Bedford Park. This is really a little bit off because most of the teaching space and settings for these first 2 years is actually the Flinders Medical Centre. And yes, you do come up to the university for some of the lecture spaces and tutorial spaces, but the university has teaching space in the hospital itself. And that means really from day one, you're within a couple of minutes walk from the wards themselves. This really means that clinical staff, academic staff can walk up from either their clinics or their research labs straight into the teaching spaces of the hospital and talk to students and deliver lectures and participate in tutorials and things. So keep in mind that this MD program is largely delivered at the Flinders Medical Centre. That gives you some huge advantages, of course, because down at the medical centre you have both academic and clinical settings combined with active research groups down there. So you get all of these aspects combined in your studies. And certainly by the time you get to year 3 and 4, yes, this is largely clinically focused, and you basically do 6-week rotations in the various disciplines of the hospital. So you're probably aware that Flinders Medical Centre is a very big centre. It's the largest by bed hospital in the state. We have a full suite of all specialties. It serves around about 500,000 people in the southern region of Adelaide, so it's a big hospital. So during your clinical years, you'll have exposure, 6-week rotations through all the major disciplines of the hospital, through emergency medicine, for example, pediatrics, internal medicine, emergency medicine, every aspect of the hospital itself. When you get into the 4th year, there are some options as well and electives you can do which are off campus. So some students choose, for example, to do an elective overseas in some very exciting areas, I must say. You can basically have almost free rein as long as you can organise, with the university's help, an appropriate clinical experience. In the 4th year, students can do a reasonable section of their electives offshore or in another part of Australia, for example, during that period. So that becomes a very exciting time for students as they're heading into their pre-intern sort of and completing their degree. So just be aware that there are flexibilities really in that 4th year where you can do your clinical sort of studies. That's most of the MD taken care of, I think. If you have any questions, of course, feed them through and we can talk about them later on. Okay, so how do we get into these sort of courses? So obviously we'll start with the Bachelor of Clinical Science, Doctor of Medicine undergraduate program first. So this is aimed at school leavers. So this is why we've got this notation, no higher education academic record. If you have started university and have completed a semester, for example, you're no longer eligible for entry into the undergraduate double degree program. You'd just be better to complete your degree and enter as a graduate. Yep. Excellent. Yep. All right. So we don't have any particular ATAR topics that we have prerequisites for. So you can come in with any mix of topics in your ATAR. The offers will be based, of course, on largely on academic merit and also the UMAT, it's actually UCAT score that you achieve. So for us, for example, we weight the UCAT at a 10% weighting versus a 90% weighting of your ATAR score. Excuse me. We don't have an interview, and this really is referring to once you get into the course, you must pass all the topics in the first 2 years and maintain a GPA of 5 to progress through the MD. But as I said, once you're in this double degree, you're in medicine, and a place is reserved for you in the MD. Excuse me. So for us versus University of Adelaide, for example, their weighting is a little bit different, so check their weightings out. Our weightings tend to favour very high ATAR scores, whereas theirs tend to favour somewhat because of the mix that they have in the interview, favour a slightly different mix of academic outcomes.
Just before we move on, sorry, we've just had a question come through on the chat, which I'm sure a lot of people do ask, if there's a minimum UCAT score required.
Yes, there are. We will update those. There's a new method of this test is relatively new, so we are setting our standards of relatively low bar. I think if we will post those online. I can't think of the score off the top of my head, but be aware. I think if your UMAT score or UCAT score rather is sort of on the low side, I think obviously that will be an impediment to getting a place offer, except if you are coming in perhaps with bonus points attached to your ATAR. We obviously have some sub-quotas in our course, so if you are eligible for a sub-quota, then a lowest UMAT score will be less of a disadvantage, I think, because you'll be competing against a smaller pool of other applicants in those sub-quotas. That's very complicated, and obviously the details of that can be found, I think, on the website that we'll talk about at the end of this. But if we have these sort of questions, we can try and work out what those scores are and post them somewhere for people a little bit later on. No, it doesn't. So we're not using the situational judgment test at the moment. We've got a question about what sections, so we're using the first 4 sections of the UCAT at the moment. So this test is still relatively new, and until we understand what section 5 is actually doing and what it's saying, we've decided not to use it in our UCAT score combinations. Okay, yep, so that's relatively straightforward. Obviously, we at Flinders do have some goals that we'd like trying to achieve really in the cohort that we come in. So people who are applying from a rural background, for example, who have evidence of living in a rural setting or regional setting, do get sort of a bonus really for this course, because we're trying to achieve a 30% rural student intake into our course. This matches up with the MD requirement that we have with for 30% of students being from a rural background. We also have a sub-quota for Indigenous students and also for students holding humanitarian visas, for example. So if you have those sort of, if you're from an Indigenous background or a visa holder, humanitarian, please consider we do have sub-quotas for you. And generally they're not well sort of serviced. So if you are Indigenous, we absolutely encourage you to apply. Okay, we've got a question about the main focus of the degree. So obviously, if you're studying medicine in Australia, all Australian universities have to teach students to a certain level. So while some may say they focus a little bit on sort of community, everyone comes out really with their medical degrees, doesn't matter where you study, very, very broadly skilled. Okay, and yes, Flinders does have an emphasis on rural health, but it doesn't mean that you're trained all that much differently to any other student in Australia, except if you're in the rural parallel rural curriculum program, for example. We will get exposed to a lot more rural medicine through that program. So yes, the emphasis can be a little bit skewed perhaps towards certain areas, but at Flinders, of course, you'll come out as an excellent generalist. You will have a good idea of rural health and the needs of that area. You will have a good idea about research, for example, because you will have done your advanced studies. So you will come out with an excellent broad grasp of medicine in Australia, enabling you to go in any direction that you choose fit in your studies. We have graduates in all aspects of Australian medicine at the various highest levels, through to running some of the major colleges, for example, and advocacy groups, to chief medical officers in South Australia and beyond. So our graduates have gone all over the place. So talking, I think we're moving on to some more aspects. We'll come to a little bit more about the subquotas and things as we go through. Now we're talking a little back again with the Doctor of Medicine highlights. So we've moved in this course over the 4 years now to what's called a programmatic assessment, where students are really assessed on a weekly basis. So students know where they're going in the course, how well they're doing against their peers as well at certain test points throughout the year. So there's no big surprises towards the end of semester through exams, for example. So this programmatic assessment process allows students to really track themselves and assess their progress through the course much more intimately than sort of essay or exam-based degree programs. Most of the time, students will be basically in team-based learning environments. So you will be put into teams and you'll work with your team on problems really associated with the course and learning objectives with the course, during lectures with the course, and during clinical sort of presentations in the course. As I mentioned before, there's early clinical skills and early patient contact are a key component of this graduate program. You will have the opportunity to develop your clinical skills through very, very advanced robotics and mannequins, for example. Excellent skills unit. We have a specialised unit where you learn all of the skills. You get to practice in a safe environment. You can't destroy the mannequins, so that's excellent. Before you get anywhere near a patient, you will have developed the skills and the confidence really to conduct some of the clinical procedures and things you need as a medical practitioner. Research program, absolutely, as I mentioned, and really the research project has a huge amount of choice associated with it. So some students actually propose their own research project. Some of them choose from a set list of projects which have been put forward by active researchers. And some students actually choose to do an advanced diploma or something as part of their advanced studies. So there's lots of options there and lots of opportunities for you to get involved in various aspects of the research side of medicine. Okay, and as I mentioned in fourth year, this is where the international rotations and electives really come into their own. So in fourth year, there's a lot of options for you to do some of your clinical training outside of the Flinders Medical Centre setting. Okay, so for entry into the graduate program, of course, you will have done a degree or be completing that degree. So obviously people are often applying in the third year of their degree, hoping to get in the following year in the MD. That's fine, that's how most people do this. Some people will come in with honours, for example, or a PhD even. So there's lots of sort of students coming in from various backgrounds into the MD as graduates. Of course, you'll need a valid GAMSAT score. And we do have minimums for that. If you're a domestic student, of course, to be competitive, you'll need considerably higher scores than what's posted as the minimums. We don't have any particular undergraduate degree requirements other than you have completed it by the time you've basically, at the end of the year that you apply. We don't have the 10-year rule, and I do believe we're still waiting the final years of that undergraduate degree in terms of the GPA associated with that degree. And for interviews which are conducted at around about this time of the year, which are being done at the moment now at Flinders for students entering next year, the offers of those interviews is largely based on your GAMSAT score and within the subquotas that you're applying for. When it comes to place offers, we combine that GAMSAT score, the GPA from your undergraduate degree, and your interview score to produce a final ranking for offers to this degree program. So are there any major questions coming through on the...
Yes, we've got a couple coming through. A lot about the Northern Territory and CDU option that's available. And I know you spoke a little bit about that, and we have had our assistant able to answer a couple of them. But one in particular is, are the CDU lectures face-to-face or are they live streamed?
So effectively, of course, Flinders has a campus up in the Northern Territory at the Darwin Hospital, and students, about 24 students per year at each year level, are studying medicine, and they're studying the Flinders program, of course. They're part of the Flinders student cohort, and effectively what happens is they tap into the video stream of lectures that are done at the Flinders Bedford Park site, for example, or the Flinders Bedford Park site tunes into the lectures that are done at the CDU Flinders campus at the Darwin Hospital. So yes, all lectures are shared and students are part of a larger cohort. Some of them will just be based in a different setting while the lectures are done, depending on where they're done. But students will be able to talk to lecturers and ask questions during those sessions, absolutely. But they do have separate facilities for anatomy and things. So when there are practicals and things being run down at the Flinders campus, they're largely run independently up in Darwin, for example.
Okay, and on a similar sort of theme, we do have some questions in regards to interstate students. So being an interstate student and someone that's applying for clinical sciences Doctor of Medicine, is there any disadvantage to them as opposed to a South Australian school student applying?
Not particularly, although we probably get... obviously, if you have a rural background and fit the rural subquota, you'll be sort of advantaged that way. But that is not exclusive to South Australia. If you're from a lower socio-economic area, for example, you also get bonus points. But again, that is not disadvantage for interstate applicants. So as far as I can say, yeah, when you apply your interstate, residency really won't have much of an impact on whether or not you're assessed for the course. And we certainly do get about 4 or 5, maybe up to 7 students from interstate each year out of a cohort of 25. So obviously it is popular for interstate students, and we do have a reasonable number of students coming in from interstate into the course.
Okay. We did have a question about the internship. Does that need to be done in South Australia, or can that be done elsewhere?
Yeah, absolutely. So once you have graduated with a degree, doesn't matter what university in Australia it is, you are eligible to apply for an intern year. However, each state has rules which differ, and so each state will actually favour, but not exclusively, but will favour local graduates first over interstate graduates. But it doesn't mean that if you're an interstate graduate, you can't get a place in South Australia, for example, or from here, a place back in another state. It's just that domestic students graduating from those states will get preference first for those places. But you're certainly eligible to apply anywhere in Australia or overseas, doesn't matter where it is. It's just that the rules of each jurisdiction obviously dictate how competitive you'll be for those intern places. But in South Australia, for example, Flinders graduates would apply both to Flinders Medical Centre, the Royal Adelaide, and various other health settings for their intern places.
Fantastic. And I think just the last question, which we do get asked a lot, before we move on to the next slide, is how many spots roughly are available in the double degree Bachelor of Clinical Sciences, Doctor of Medicine?
So for domestic students, it's around about 25. We will enrol about up to 28, just in case one or two students decides not to continue in the course. But so it's around about 25 to 30, I would say, places are available. So keep in mind that obviously it's very competitive. We have over 400, obviously, first round preferences generally for the course, which means that it is going to be a competitive process. And most students, of course, come into the program as a graduate. So in the first year of the MD, the majority of students will be graduate entrants. 25 of those students will be coming from the undergraduate clinical science degree, and we also have up to 30 international students starting in the MD, for example, in any 1 year. There was a section on quotas, wasn't there?
Yes, the next slide.
Okay, so this slide really is about the graduate entry process and the subquotas associated with it. And really what is clear, and what I wanted to point out, is this particular statistic here, 75% Flinders qualification. Now what that means is the Flinders MD program favours graduates of Flinders University. So there is a quota that 75% of our students coming into the MD should hold a Flinders degree. Now we will have probably up to around 110, up to 120 perhaps first year MD students coming in any 1 year. 25 of those students will come through the undergraduate program holding the Bachelor of Clinical Science. We have 25 places quoted for subquoted for students holding degrees such as the Bachelor of Medical Science, Health Science, Paramedic or Science degree. So if you're studying any one of those Flinders degrees, you're eligible for this 25 place subquota. Outside of that, 75% of students will hold a degree of any type from Flinders, for example, including students that don't make it in this first subquota. So if you don't get into the 25 places, but you do hold this medical science degree, you're still eligible for the 75% Flinders degree holding subquota. And then there's other subquotas such as the humanitarian, Indigenous and Indigenous entry stream subquotas as well. What this really says is if you're planning to do medicine and you don't get into an undergraduate program and you're wanting to do graduate medicine in South Australia, the best thing you can do is preference a Flinders degree for your undergraduate degree. That will allow you access to these quotas, for example. If you're an interstate student and you haven't done a Flinders degree, for example, you can see that there's only 25 places really left for you to compete for. 25% of places, that is. So if you're a Flinders, South Australian student aiming for medicine, please consider very, very carefully the strategy that you'll need to be successful for getting into the MD. And that will be to consider a Flinders degree as your undergraduate degree. Obviously, we are a sort of rural focused university, and we do have this subquota of 30% for rural background students coming in. And so that if you are from a rural background, you will be part of that subquota as well, on top of the other subquotas perhaps. So these are complicated sort of subquotas, so please take some time to get your head around them. If you have any questions, you can always contact the university a bit further about those subquotas or what they actually mean.
Sure, so we do have a question in regards to this 75% Flinders qualification. So I guess if you decide that your passion outside of medicine might be engineering or maybe it's nursing and it falls outside of these 25 places, they'll still have an advantage over if you chose to do a Bachelor of Engineering, mechanical engineering. You'll still have an advantage in applying for the Doctor of Medicine if you study that at Flinders University, because you'll fall into that 75% of reserved places. However, if you study engineering at another university, then it does become a lot more competitive for you. So it is always a tricky one to consider, I guess, if the Doctor of Medicine is still extremely competitive, which is why we do strongly advertise these pathways into medicine and considering perhaps Plan B and what Plan B might look like for you. Yes, you may have a slightly higher chance of being made an offer into the Doctor of Medicine if you do choose one of those 4 degrees, the Bachelor of Medical Science, Health Sciences, Paramedic Science, or the Bachelor of Science in Biotechnology. But if that's not a passion for you, then perhaps it's worth considering another degree at Flinders and looking at applying for the Doctor of Medicine after that as well, because you never know. The Doctor of Medicine does remain extremely competitive. You may not be made a place in the Doctor of Medicine, so you want to be left with a degree that you're happy with at the end of those 3 years of studying, essentially. And I'm sure you come across that a lot.
Yeah, absolutely. So there's a few questions about this process and whether you're eligible if you hold a degree from a non-Flinders university. Absolutely, you're eligible. That will be for the 25 remaining percentage of places for non-Flinders degree holders. Now, it doesn't mean that those 25% places will be taken up by students only with non-Flinders degrees, because students from Flinders who don't get into this quota or that quota are still eligible for the open entry anyway. So it just means that first, if you are eligible for this, you're ranked top 25 get offered places. If you're not within the top 25, but you are within this 75%, obviously you'll get ranked again and offered places. If you're not in this 75% again, but you're in the pool and you've met criteria, you may be offered a place in the final sort of non-quota rankings. Some students who do hold degrees from other universities can get a Flinders degree by doing, for example, an honours degree or a graduate certificate, things like that. So if you do hold a degree, you've done perhaps a 3 or 4 year program somewhere else and you think, oh, I've missed my chance. That's not true. You can do a top-up graduate certificate, for example, get yourself a Flinders qualification and be eligible for that 75% sub-quota. Okay, so I think, yeah.
So I think what we'll do now is we'll perhaps move on to applying for university. I understand there's still some questions coming through and we'll get through to those as well. I did mention that unfortunately we won't be able to answer all of your questions here today. There are a lot of people in attendance, which is fantastic, but we will have tried to answer some of the questions that are perhaps more broad and perhaps more people have those same questions. So I guess most of you have already applied for the Bachelor of Clinical Sciences Doctor of Medicine, which is why you were invited to this webinar. I will mention though that if you are one of the people that discovered this webinar online or via our website, you will need to place the Doctor of Med or Clinical Sciences Doctor of Medicine into your SATAC application by Monday, 2nd of December. After that, there will be no, you will not be considered at Flinders University. We do, for the first year ever, have a main offer round on December 20. So that's where most courses at most South Australian universities will be making some offers. However, the Bachelor of Clinical Sciences, Doctor of Medicine is not included in the December 20 round. That means, unfortunately, you will need to wait until January 10 to receive an offer for the Bachelor of Clinical Sciences, Doctor of Medicine. So this is where it becomes really important on your SATAC application to look at your pathways into medicine. As Michael suggested, you do have a slightly higher chance of being made an offer into the Doctor of Medicine if you've completed an undergraduate degree at Flinders University. So it's really worthwhile looking at something like your health sciences or paramedic science or another Flinders degree to list in your SATAC application, somewhere below your Bachelor of Clinical Sciences Doctor of Medicine. If you're not quite sure which one you would like to do or which direction you should go, then please feel free to get in touch. We will always be available to answer any questions you have about this. One point that we do want to advertise as well is after the offers have been given out for the Bachelor of Clinical Sciences, Doctor of Medicine, you can actually call our office, the Admissions and Prospective Students Office. And we can let you know roughly where you sit and the likelihood of you receiving an offer into the Bachelor of Clinical Sciences, Doctor of Medicine in later offer rounds. We won't be able to tell you exactly where you sit, but we'll be able to just let you know the likeliness of you receiving an offer and perhaps discuss your SATAC applications and how you might rearrange those moving forward. So the number you can call there is the 1300 354 633. Press option 1 and that will be coming straight through to our team. That's a really busy time for our team. We're always on the phone helping students out, looking at their SATAC application, guiding them through the processes, and letting them know what's perhaps best for them in their next step. On January 15, so after that offer round where medicine offers will be given out, there will be a Pathways to Medicine webinar. So that's where we will go through in detail all of those sub-quotas that we discussed about the pathways into the Doctor of Medicine, or your options of perhaps applying for the Bachelor of Clinical Sciences Doctor of Medicine again, but of course you can't have any record of study if you did want to do that, and we'll be discussing that in more detail. But again, if you have questions prior to that, please feel free to get in touch. Okay, so I think we've got a few questions coming through, which you've been reading. Was there
Yeah,
something
I did
you wanted
notice
to...
a couple about sort of workload and whether you can have a part-time job. Certainly in the undergraduate degrees, and this would be the same for the double degree 2-year, the first 2 years, for example. Typically, students can arrange their university life so they're on campus not 5 days a week, but less than that somewhat. And although it varies a lot depending on degree program, for the clinical sciences, I would say there's probably 15 to 20 contact hours a week at the most. That means that students probably can do part-time jobs. Obviously, you need to monitor how you're going in the course and whether or not working for you, and because obviously you have a goal of getting into the medicine and staying in the double degree. When you're in the MD, I would say probably not. I think part-time work would be extremely difficult, although some students do it. But contact hours are probably double what they are in an undergraduate degree. So students are generally on campus 5 days a week for most of the day because of the nature of the MD.
Okay, so we've had a question with the Bachelor of Clinical Sciences. You mentioned that there is a health science stream and a medical science stream. So the questions come up, this person's obviously looked into it a little bit. If you choose the health science stream, do you have enough electives then to do the medical science stream as well?
Well, yes, you could do the same topics that are offered in the medical science stream as electives. Generally, though, you probably don't want to, in second year, go back into a first year topic. But there's a lot of, so any electives that are listed for either of the streams are available to students. So there's no real, elective restriction. So what I would say, if you're in the medical science stream, you can certainly do electives from the health science pool. And if they're not listed and you have an elective, for example, that you really want to do, as long as you've met prerequisites and you email me, for example, as the coordinator of the course, I can approve an elective for you, for example.
Another question which we do get asked a lot when we go out to schools is if you have a low UCAT score but a higher ATAR, do you still have a chance of getting into the degree?
Nothing stops you getting into the degree. It comes down to competition. So unfortunately, what it means is, because there's only 25 places, obviously high ATAR scores are a huge advantage, but similarly higher UCAT scores are an advantage. So it comes down to who's applying. And if the mix in any one year included a lot of people who had low UCAT scores, you'd be competitive. If the mix generally, as we've seen it though, is people getting high scores in both areas, but not maybe the absolute highest score. So keep in mind that you don't need to be 100 out of 100 for these things, particularly if you can get bonus points through being in a lower socioeconomic sort of area or through being a rural applicant, for example. Your ATAR score won't need to be as high as those students not applying with those sort of with those points value areas. So it varies. It's different every year, but obviously it's competitive. So the lower the score, the less competitive it will be.
Yeah, And we certainly do get many people applying that perhaps receive the perfect score at school, the perfect ATAR of 99.95, and sometimes still aren't made an offer into the Bachelor of Clinical Sciences, Doctor of Medicine if they haven't performed so well in their UCAT. So as Michael mentioned, it is really varied and depends quite a bit on that combined score, which is again really important that you have those backup options in place because nothing's secured, unfortunately.
Yeah, and unfortunately, yes, there is only 25 places. As I said, we do enrol up to about 27 or 28, but that doesn't make much of a difference. It's below 30 for domestic students, which is not a large number, I agree. But we still want to maintain, obviously, a graduate degree process for our degree, and we want reasonable numbers of graduates coming in as well as undergraduate students.
Sure. Okay. I understand there's a few more questions there, but I think what we might do, unless I'll just have a quick look through and see if there's some I've missed that might cover. There's a lot of questions about scholarships, and I'm not sure if you're referring to scholarships as bonus, the adjustment factors, bonus points. They're two different things. I will just mention that if you are looking for adjustment factors, or which were previously known as bonus points, the only bonus points that are counted towards the Bachelor of Clinical Sciences, Doctor of Medicine are school equity points. So if you go to a school that receives equity points, then they will be counted. Or again, if you or your parents are on a concession card, then you can apply for those adjustment factors. But in regards to scholarships, once you get to university, there's certainly lots of scholarships you can apply for.
Yep, and the ones that I can think about off the top of my head would be for the rural scholarship through the Flinders Housing. So if you're coming from a rural area in South Australia, for example, and you'll be staying on campus, you can apply for a housing scholarship.
Okay, sure. And we do have, so I will reiterate again with the bonus points and adjustment factors, the subject bonus points do not count towards the Bachelor of Clinical Sciences, Doctor of Medicine, only the school equity points or concession cards, personal equity points. The rule of percentile and raw ATAR scores. A question that we've sort of covered, and again, it's a hard one to say, especially with UCAT being the first time it's being run this year. But I'm not sure if you know.
I think it's sort of pointless trying to put a figure on it because it comes down to this is a very competitive process. There's a mix of things. We don't know what your background is, whether you're eligible for any of the adjustment points. So it's really speculation, and at the moment, it would be sort of pointless to try and speculate on a number.
So that's in relation to the UCAT and ATAR percentile scoring. So yeah, it is. I know it's a frustrating answer, but unfortunately, it's the best one we can give at this point in time. We don't have any of those stats and figures to give you. And going back into the scholarship side of things, there's lots of different scholarships available. Some are for academic. If you're a high achiever, then there's some scholarships available, but not all of them are as well. There's lots of scholarships that anyone can apply for. It is just a matter of filtering through the scholarship page on our website and looking at them and seeing if you meet the eligibility. Because there are lots of scholarships available, and lots of them actually go unused each year because people don't apply for them, because it can be a little bit tedious sorting through them and seeing which ones you're eligible for. So I do recommend that you take the time to do that if you do come to Flinders University. Okay. I think, and I've had this question come up a few times as well. This will be if we have a medical science course. I will mention with the Bachelor of Clinical Sciences, Doctor of Medicine, there is no way you can transfer into this degree. The only way you can get into the Bachelor of Clinical Sciences, Doctor of Medicine is if you get into it straight out of school or without a record of study at university. So once you have attempted even one topic at a university, it means you are no longer eligible to apply for the Bachelor of Clinical Sciences, Doctor of Medicine. It then means that you need to complete an undergraduate degree, where it be at another university or at Flinders University, and then apply for the Doctor of Medicine. But then, of course, you need to sit the GAMSAT. Based on the results of your GAMSAT, you're invited to an interview, and then they'll look at your weighted GPA as well. So you can complete that undergraduate degree anywhere, but you do need to then go through the processes and apply for the Doctor of Medicine. And I think we perhaps might leave it there for now, because I think these questions are going to keep coming through, and I know that we are running out of time at the moment. So what I'll do is I will leave it there, unless there was anything else you perhaps wanted to say, Michael?
No, just thank you very much for tuning in, and yeah, any questions, please feed them through, and they'll be addressed in due course, I'm sure.
Yeah, absolutely. Well, thank you very much for joining us today and taking the time to spend it out with us. Again, if you have any questions that you're really wanting to know the answer to, please feel free to email us at askflinders at flinders.edu.au, and just putting that into the chat box now. And we will get back to your questions. We don't just let them slide. We absolutely answer them. We do see them. So please feel free to ask us questions, and we will get in touch with you for that one. But thank you once again, and good luck, everyone, if you are in Year 12.
Best of luck, and see you next year, some of you.
Yeah, we'll see you next year, and good luck with your exams if you are in Year 12. We hope that will go smoothly for you, and we will see you soon. Thanks a lot, everyone.